On this morning's Health Watch, we look inside the H1N1 virus, and here again is our own Dr. Jennifer Ashton. Good morning.
Good morning, Harry. Harry, in some people, the H1N1 virus can be deadly. So let's take a look inside the body to see what actually can happen and why. Germs, they're everywhere in our homes, offices, and schools. Some are harmless, but others can be deadly, like the H1N1 virus or swine flu. It's spread when a carrier coughs or sneezes. Another person touches an object or surface with the flu virus on it and then touches his own nose or mouth. The virus is inhaled by the body and goes straight to the lungs. The virus attaches to the lung cells and the body is now infected. Over the course of days, the blood vessels in the lungs or the air sacs are damaged. Fluid leaks from the blood vessels into the air sacs of the lungs. While some air sacs fill with fluid, others collapse altogether. When the air sacs collapse, the lungs can no longer inflate as they normally would with oxygen. The lungs become stiff. Without air entering the lungs, the amount of oxygen in the blood drops. If diagnosed early, some patients will get extra oxygen supplied by a breathing machine. Others may fall into a coma. Patients die from H1N1 because their lungs give out via lack of oxygen or drowned by fluids. At this time, 50% of H1N1 deaths are due to viral pneumonia. Half the fatalities have been in people with pre-existing medical conditions like obesity, diabetes, and pregnancy, Harry.
It was so interesting to look at that animation because I'm sitting there looking at it and I wanted to know, is that flu or is that pneumonia?
Well, what that described is a situation that we refer to as ARDS, or acute respiratory distress syndrome, where the lungs literally become like sponges and they can't exchange oxygen. That can happen with a viral pneumonia, it can happen with a bacterial pneumonia, but half of the deaths due to H1N1 have been due to this viral pneumonia, leading to that kind of pulmonary failure.
So it becomes more complicated, especially if you are compromised in some way in the first place.
Absolutely. So what the CDC reported to me last week when I was in Atlanta is that as they've studied the autopsy results of the people who have succumbed to the H1N1 virus, what they're finding is about half of the cases are in people who were either obese, they had diabetes, they were pregnant and suppressed their immune system, so they were at a higher risk going into this virus, which again, we have to emphasize in most cases have been mild, but they were at higher risk going into severe complications that then led to their death.
I thought that was so interesting to see that animation because you literally saw it transform from what seemed like a normal flu virus to something which was much more insidious and in fact ultimately deadly.
Right, and there's a variable time course, Harry. Sometimes it happens over hours to days, sometimes it happens over weeks. But again, once that ARDS sets into the lungs and the patient is put on a ventilator, multiple organ systems then begin to fail, and the mortality rate can be as high as 30 to 50%.
All right, we're going to talk more about this in the next hour. Dr. Jennifer Ashton, thanks so much.